Hi, my name is Mos Valletta, and I'll be talking about Clostridium tetani. I'll be referring to it as C. tetani moving forward. All right, so C. tetani is a prokaryote, a bacteria, and it causes tetanus, also known as lockjaw. Below is the taxonomy for you to look at later if you're interested. All right, so the history. In 1884, it was first produced in animals. 1889, it was first isolated and proved that it caused disease when injected to animals. In 1924, they found that formaldehyde inactivates a toxin, which led to making the vaccine we know today. All right, morphology. It's bacillus, meaning that it's rod shaped. It's gram positive. It is a spore former, so it can remain dormant and be resistant to high heat and antimicrobials. And it's also obligately anaerobic, which means that the atmospheric oxygen poisons the bacteria. Here's a picture of the bacteria. You could see at the end of the cell, there's that terminal endospore. So reservoir, you can find it in soil, water, and intestinal tracts and feces. The big one here is soil, especially when it's treated with manure because it contains animal feces. All right, so geographical presence. It's global, worldwide, most prevalent in South Asia and Sub-Saharan Africa due to its high population. It's also hot, damp, and rich in soil. So the map here, you can see the red, and that means that they're the least, they have the least coverage of the vaccine, which leads to more prevalence in that area. All right, transmission. It's usually through an open wound or a break of the skin, so it's indirect. The wound can be major or minor, but most common though, it's minor because major wounds are usually cared for properly versus the minor wounds. It's also not transmissible from person to person, so it is not contagious. So the bacteria produces two toxins, tetanolysin and tetanospasmin. Tetanospasmin is the main one here that causes the disease, and it acts at several sites in the central nervous system, and that includes the spinal cord, the peripheral motor end plates, the brain, and sympathetic nervous system. So what it does is it interferes with the production of neurotransmitters, and it also blocks inhibitor impulses. All right, so three main forms. There's generalized tetanus, localized tetanus, and cephalic tetanus. It could be within the generalized tetanus, it could be given through childbirth, which is called neonatal, and it's due to the infection through the umbilical stump. And this is due to contaminated supplies during delivery. And also the mother lacks the immunity of the disease. So it cannot pass it down to the child. Okay, and then within the generalized tetanus, the main symptoms are listed below, but the biggest one here is the muscle spasms. So the muscle spasms are due to that blocking of the inhibitor impulses. So diagnosis, physical examination, the jaw muscle spasms are very indicative of it, but a test they do is the spatula test, where they take a tongue blade such as this, or even a metal one, and the usual negative result is gagging and trying to get the blade out of the mouth, but a positive result is they end up biting the blade. Incubation period, 8 days. The spasms would last about 3 to 4 weeks. Recovery is about several months or even years. Treatment. So some spasms can be very, very, very fatal, where it leads to the person to stop breathing. So airway protection is very important. Carrying the wound, antimicrobial therapy, and then human tetanus immune globulin. So toxins irreversibly binds to tissues. So with the unbound toxins, the globulin, it neutralizes it. And then benzodiazepines for muscle spasms because it sedates the person. And then tetanus toxoid, which is the vaccine, because having the disease doesn't give you immunity for it. So prevention. DTaP and Tdap, there's two different ones based on the age of the patient. So DTaP's for children younger than 7, Tdaps for 11 to 12-year-olds, Tdap booster, and then is given every 10 years after that. We could see through this trend and the fact below that the vaccine has been very, very effective. All right, so people at risk are the people in underdeveloped countries and people that are not vaccinated or they don't do the 10-year booster. And this is primarily because they don't have access to the vaccine or they just choose not to. And then activities that increase risk, intravenous drug usage, and being around soil. And that's my presentation. But my question is, why is a rusty nail commonly associated with tetanus? And here's my references. Thank you.